Good afternoon, everyone, and thank you all for being here. This is a special committee on COVID response efficacy. I would like to start with the pledge, and Alicia, would you lead us in that, please?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Alicia. I would like to take a moment just to read what the mission of this committee is. This bipartisan committee is tasked with investigating and evaluating the state's response to the COVID-19 pandemic. The committee will function in a science-based, fact-finding review, specifically acquiring comprehensive, accurate data and all related information pertaining thereto. Areas of particular focus will include the administration of federal guidance, acceptance of federal funds, and implementation of the emergency use authorization vaccination efforts. A report will be issued outlining the committee's findings and the impact on New Hampshire. Now, it doesn't state when our report is due, but as we are elected officials, the normal date is usually November 1st of the current year, 2024. And I would like to welcome everyone here. I would like everyone to I'd like to discuss with everyone about the meeting time and the dates, to see everyone's availability. And my thought is that we would do this in chronological order, but I am open to suggestions on how the committee would like to proceed. So if anyone has any thoughts, the normal date would be Fridays at the same time. Go ahead. Representative Groda.
Thank you. I spoke with the other representatives who could not be here, and Friday is a good day for us. We would prefer the morning because some of us have committee meetings in the afternoon. So if we could meet in the morning, that would be best for us, if that would work for at least 5 of us.
How does that work for the rest of the committee? Yuri, Representative Belcher, Polovitz, and could you let me know?
I think that would be okay. We're in education together, so typically we don't have Fridays.
We asked for
For me, afternoons are better, but I can be flexible if the rest of committee needs mornings. I can be amendable to meet on Friday mornings.
Representative.
Yeah, I'm actually, I would love Friday mornings. The earlier the better, for me. And I just wanted to make sure that if there's any, like today, I had to testify on a bill, so that if any of us have, if there is something with another committee that we run out and can come back, but I would love to do mornings as well.
Okay, so hearing that Friday mornings would work best, would 9 a.m. start time be amenable to folks? That would give us 9 to approximately noon. Okay. For the future, we'll plan on Friday morning meetings starting at 9 a.m. I know that we are coming up against a session break. However, with the amount of information that this committee needs to get through, I'm wondering if everyone is available on February 22nd and March 1st.
Well, I think March 1st is the end of the break, right?
It is.
Yeah, so I don't think any, I know that the 5 people that I'm representing right now are not available because some of them are going away.
My kids want me to go away. I don't know if we're gonna go away or not, but if we're here, I'll come, so.
February 22nd would be the start of the break. Is that amenable to everyone?
I was hoping to sneak away, but this takes priority, so I will not sneak away. If we're going to meet, if we aren't going to meet, I'm going to sneak away.
Yeah, Friday, February 23rd and March 1st works for me.
Representative Grota, did you?
Yes, are we meeting once a month? Every other, like, are we gonna meet twice a month? Because if we do that, maybe we say that we're gonna.
No, we're going to be meeting every Friday.
Oh, well, okay. That's not going to be.
That
I
was
have
the
Joe
plan.
Carr on Fridays, and Karen Ebel has other. Okay.
And that's why I was thinking some afternoons, because I know some people have meetings in the mornings. So I wasn't sure, but we can, I will reach out with the rest of the committee and find out and let everyone know where everyone stands.
Can we be flexible on our Fridays as far as mornings or afternoons based on the committee schedule?
I think that would be prudent.
Yeah, I agree. The flexibility of it, I'd be happy to try to put everybody, all the representatives in kind of like one column, and then, especially with commitments and Friday, and just to do a tally, I can do that to see where things come, and then when we're placing dates, so I'll do that.
Earlier today, we received a email from DHHS. Trish is here, and to tell us that they were already working on a report, a pretty comprehensive report. I'm not sure if everyone had a chance to look at that, and I was just wondering if anyone would mind if I had her come up and kind of speak to what that report would entail and tell us a little bit about it. Does anyone object? Okay.
Good afternoon. For the record, my name is Patricia Tilley. I am an Associate Commissioner at the Department for Health and Human Services. Of note, for much of the pandemic, I was also the Director of Public Health. I am new to my role as Associate Commissioner. Public health is still within my book of business, though. So I have some experience. We were just talking about March 2020. So I have been there throughout the entire time. I have an incredible team, as many of you know. As you go further into your committee, I hope that you'll take the opportunity to hear from them, the folks that are absolutely experts in those fields. I was saying, you don't want me to get here and talk about the laboratory and the Panther machines and all of that. Like, we've got great people who can do that. So speaking towards this after action report called an AAR, the governor was very interested in ensuring that we had a complete record of what the response was, what the challenges were, what the strengths were, and how the state came together. And so he charged Homeland Security and Emergency Management, HSEM, to work with a vendor, with a contractor, to develop that after action report. It is well underway. It will be completed in June of this year. There is a draft right now that isn't ready for public vetting quite yet. They're just getting in the information. There was a series of interviews and surveys that were cross-cutting across many, many different stakeholder groups. As I noted in the email this morning, it is far beyond just the health and medical components of the response, and really takes a look at our overall level of preparedness to begin with, the command structure, the unified command structure that was based out of the State Emergency Operations Center, our communications, how we made decisions and what kind of compliance we had, which I know is something of interest to this committee, the financial management, not only of specific, I know there is some interest around vaccine, but overall around the financial management of all of the COVID funds that came into the state. Of course, the health and medical components, which would include both the testing, the policies, vaccine, eventually therapeutics, all of those components come together. And so it's taking a look at that, looking at how we manage the logistics, our public-private partnerships, and public information. In that public-private partnerships, one of the things that I'm very proud of was the governor had stood up something called the Governor's Reopening Task Force that really worked in those early days to hear from community, from industry, to understand what it would take take to reopen and reopen in a way that was safe for their staff and their customers. So that's the high level overview of what that after action report is. It's underway. It won't be done until June, but I'm sure that there are pieces of it that we can certainly start exploring within this committee as well, so as not to duplicate work.
Does anyone have any questions? Please.
Thank you. Ms. Tilly, I spoke with members of my community before today, and some of them wanted to come and testify before the committee. And I think it would be important to have people from New Hampshire who were involved with municipalities or public utilities or public safety organizations come and speak with us. And what was the link between your activity and what municipalities were doing?
Oh, that's an excellent question. Thank you, Representative Grota. So we worked closely, we being the Department of Health and Human Services, worked very closely under this, what was called the Unified Command Structure that was based at the State Emergency Operations Center. And within that entity, that was the emergency group that was pulled together. And so it had representatives from all of the most major impact state agencies. So everything from Health and Human Services to economic supports to transportation. And HSEM, Homeland Security, has a special relationship with the municipalities. And so there was a direct messaging to the municipalities through that unified command structure. For example, they had early, it was more than this, but sort of once we got into a steady cadence, there were once a week calls with the municipalities from Homeland Security to talk about what the changing guidelines were. Again, all of us may have memories of that time when everything shut down. How do we reopen? Restaurants shut down. How do you reopen that? What was the role of a health officer in a community, even down to how do you safely plow the roads when you might have like two guys in a truck. So like those were the breadth of things that were discussed. But typically most of the messaging came from Homeland Security through those channels out to the municipalities.
Thank you. So, Madam Chair, I would imagine that we'd want to hear about that because I know for our own town, we are part of the Seacoast community and we have a lot of state parks.
Mm-hmm.
And so the commissioner of state parks was in contact with us, I think it was every week on Friday mornings, actually, to talk about what was going on and what the protocols were going to be for people to park because it was outside, right? It was available to the public.
Yes, I mean, my recollection of that time as well, especially early in 2020, was the state parks commissioner at that time was actually on that reopening task force. And so he was engaged right away going, how do we reopen safely again? Especially that first summer, everybody, public health included, wanted people to get outside. I think we can all remember the cars parked up on 93 outside of Franconia Notch, which was a safety hazard, but it was a reflection of the fact that everyone was encouraging everyone to get outside for your physical health, for your mental health, for every reason. And so there was communication that way. I'll also note that as part of that unified command, there was a leadership call every morning at 8:15 in the morning with from the governor's office down to the highest levels of state agencies. So the central communications, while never perfect, no one can ever look back in an emergency and say the communications were great all the time. There was a concerted effort to make sure left hand knew what right hand was doing throughout. Lots of things we learned through that process, but that certainly was the plan going through, and it evolved as time went on.
Representative Paulo?
Thank you, Madam Chair, and thank you for taking my question. I wonder about after action report. Thank you for working on it, and I understand that it's about to be ready in June, but as our committee is trying to get some wisdom from it, hopefully earlier, is there any chance like you can provide the committee with some early findings from that report or something?
Sure. So thank you very much for that question. So as I said, Homeland Security are the folks managing it right now. So we'll work closely with Director Buxton to understand what we can share, what we can't share. Certainly sort of probably, I will go out on a limb and say there's probably some broad strokes that can be shared right now. I don't know that they're ready to share a draft at this moment because it's still actively being written. But I think there are some broad strokes learnings that are certainly appropriate as your committee goes on and meets. But again, the final document will not be available till June.
And if you indulge me for another question, it's not something we were planning to go deep into today, but since you're mentioning, as far as I understood your words, you were talking about people who were going hiking and that everyone was encouraging people to go outside. Can you a little bit expand on it? Because the reason I'm asking, it's not something that I remember. So is it your recollection that it was a public policy advice for people to go outside?
Sure. So thank you. I know that the governor was very encouraging of people to use outdoor spaces. At that time, we wanted to make sure that everybody could get out and about. I don't know that it was a written policy anywhere, but it certainly was encouraged for people to get outside during those, especially summer 2020. And of course, from then, I would not have been I'm not a former director of public health without saying that getting outside is always healthy for you. Everyone should get outside and get their exercise every day. That's my public health message of the day. But even especially then, when there were so many unknowns about indoor spaces, we knew that outdoor spaces were certainly better for folks to be able to be out and about. There were always questions about, masking. And I know that this committee will probably take on some of those masking questions early on about the appropriateness of that and where that was appropriate and the evolution of our understanding of masking. And even, again, thinking about it in a chronological way when we simply did not have supply chain in, March or spring of 2020 and how that changed over time.
So, Madam Chair, as I'm thinking about this and listening to Director Tilley and listening to Representative Poloff, I'm wondering if if we put together a list of items that we want to talk about, because unless we can communicate that to the public, no one's going to know what we're talking about at our particular meetings. And so to encourage public input, what are your plans on doing that?
Representative Belcher.
I was going to wait, but this is actually a perfect time to interject with a comment I was going to make on the proposed path forward. I like certain ideas about the chronological approach, but there's a certain amount of concern that I have if we work chronologically. One of those big concerns is that because we have limited space to get everything done, we may either get bogged down in any particular area for too long, or the alternative, because we're so trying to recognize and we have limited time, we might move too fast over certain periods of time. So I was going to recommend, if we would take it under consideration, more of a topical based approach where we identified the sort of segments of what we're looking at and attacked it from that angle. So for instance, we could have a big topic such as the treatment protocols that were promulgated. And then underneath that, there could be subcategories of, okay, we could look at early treatment protocols, late treatment protocols, ventilators, vaccines, and sort of, instead of going from the beginning forward, it's just my belief that it would be a little bit easier to organize in that manner.
Thank you for that. I agree. And so my thought, and that's why we're having this meeting today, is so that we can all discuss the best way forward. Oh, thank you. I'm sorry. The best way forward would be to, I guess, start at the beginning, but we're going to find out immediately that one of the protocols is we shut down. And that the next thing was masking. Those were two early on protocols that happened in a chronological order. And I think if we look at that, you'll find that when we did shut down, then we were encouraging the open spaces, which brings in the commissioner with the state parks. Then we'll get into, as we go on further, a little bit further down, we'll see that where the protocol started coming in with the hospitals and the nursing homes and things like that. But like I said, the reason for today's meeting is to discuss the path forward and how where do we want to start first? And I am open.
So I'm wondering whether or not, I'm so sorry. I'm wondering whether or not we might want to start with the small picture, because the small picture is where, like, for example, I'm thinking of municipalities. Municipalities took their direction from Homeland Security. So as a result of their direction from Homeland Securities, what are the things that they did? What would they recommend be done again, and what didn't work? So that we have some, what's the word I'm looking for? We have some experience on exactly what happened on our constituent level, because that is who we represent, right? So, and then including that, for example, this morning I attended a school event, and I spoke with the school psychologist, and I said to her, what are the things that are now that you are experiencing as a school psychologist? So, there are things that we can learn from what our constituents experienced, so that we know what, God forbid this ever happens again, what are the things that were useful and what are the things that were not useful. Does that make sense? I mean, I'm just trying to think. I know that my database are my constituents, right? That's where I'm going to go.
Absolutely. I do think that it may be useful, to have Director Buxton in here to talk about how he communicated with, because obviously he was at the top and everything was trickling down. And it would be interesting to see where he was taking his direction from and how everything was filtering down. And then from that, we can get into the municipalities, the schools, and how it affects our citizenry, our constituents. Any thoughts on that, Representative?
Yeah, I was thinking if we were kind of topical, but one of the aspects of each topic would be the municipality. For instance, education might be a topic, but we would have how it affected the schools, how it affected the parents, how, all of those people. So that would be a topic, but it would include, and when we do a topic, we could ask residents of the state to come in and speak to us if that's what we wanted to do, or I don't know, that might become many hours.
I
or at
think
least write to us.
right. I think it's essential that the people have a right to come here and be heard and discuss what they experienced. People experience different things. And I think it's important as representatives that we hear all sides of the issue so that we can get a better understanding of how people were actually affected. Representative Potenza.
I have a question for you, Mrs. Tilley. Mrs. Tilley.
Thank you.
Okay, so my question in regards with this kind of report that is, you said is due in June.
Yes.
So this is coming from, you're saying, the executive branch?
It is coming from Homeland Security Emergency Management, so from the Department of Safety, executive branch.
Okay, so the feds or the state?
The state.
Okay. So this is, because when I read your email, I guess I thought it was coming on the federal side, not on the state side. So this is going to be exactly specific to New Hampshire.
It is 100% about New Hampshire. Certainly, federal guidance and federal inputs are part of that, but it is from a New Hampshire perspective on the New Hampshire specific response.
Okay, so if we're going to ask for some information, one of the biggest things that I would like is to literally have kind of spelled out, you know, all the way down from the dime to the nickel to the penny, for the money that has come in and run through, whether it be, you know, through CARES, through all of that, um, through the executive council, federal, state, whatever. I'd love all of that. I mean, is that something that you guys will be working on? Because that's one thing that I could give you guys in advance that we would like to have, I know.
Thank you very much for that question. That's a tremendous undertaking, as you can, as I'm sure you appreciate. And so certainly I will bring that back for all of the state agencies, because as you know, money came in from every corner, and money came into each of the state agencies in different ways. Money came directly, certainly we certainly know about the Gopher, that has been managing that set of ARPA money. And I can't, my brain is freezing for me of what ARPA stands for, but that is a huge pile of that money. And so I think to the degree to which we can provide that information, you know, we certainly have anything that was after the state emergency certainly went through governor and council. So there is all public record. It came in through fiscal committee. You know, during the actual state emergency, there was information provided to those entities, but there were some expediencies because of when we were in the actual emergency in the 2020 times. But my short answer to your question is that will take effort across all of the state agencies to produce.
Yeah, I'm really only interested in because you're representing here from
Yeah.
DHHS. I'm only interested in your bucket, like
Okay.
Gopher and all of that. I know how to go about that. I'm really only interested in specifically when it came to you guys.
Sure. So we certainly have all that information that's available. We would probably need to know more from the committee in the way in which to give that information, because it's so dense that I don't think it's actually fair to you for me to just drop off like giant stacks of paper. So I think we'd look forward to understanding what it is you want, how we can present it to you so that it's actually readable and understandable, because it's dense.
Thank you.
Yeah, and I think from a committee standpoint, it's something that we'll have to discuss amongst ourselves, so that there is direction, because if not, like you said, we could be all over the place. So, and thank you again. I appreciate it. So Representative Belcher, did you have something?
I was just, oh, you're good. Thank you. I was just going to mention on that. I think one of the things we'll probably perhaps look for at some point would be for the persons who actually have the expertise with the financial side of that at DHHS to come here with, you know, that data available to us to be able to help walk us through some of that. That would probably be extremely helpful.
Representative Bullock?
So on topic like how we should prioritize our work, I would I don't think we should just go in a chronological order. I like the idea about topics. If anything, I would go in a reverse chronological order, because yeah, it's very important to see what mistakes we did in 2020 with ventilators or with masks, but I would rather concentrate on COVID response is still ongoing, like state is still and there are some questions like, I don't know, about vehicular remdesivir that is being used to treat it, like is it the best and safest treatment or not, or state is spending resources on promotion of COVID vaccine, and we are seeing that despite this promotion, vaccine is highly unpopular. So as a committee, it would be nice to see if it's actually like safe and effective, and maybe we need to promote it better, or maybe if it's actually not an effective like, because it's we are currently state is currently like heavily involved with it, so I think like studying something that we as a state reps can act right now is more important than just getting some lessons from 2020.
Representative Polov, I think that having Director Buxton in here from Homeland Security, he could technically walk us through the beginning and to what's going on now. He could kind of give us an overview, and I'm not positive that he could do that, but I'm going to surmise that he could probably give us an overview on how, a step by step on what's gone on in the state from 2020 to now. I also think that once we hear from him, I think, as we go through chronologically through topics, and bring in the municipalities and talk about our state parks, we can learn about a little bit about how that affected people and how that affected everything through today. So we don't have to, even though we're going to do it somewhat chronologically, we just have to figure out, I think the big thing is to start with Homeland Security, because everything was directed through them, so that we have a better idea of as we trickle down. Because, I mean, had a good point. I never even gave it a thought that you had to think of guidance about driving in a plow truck, right? I mean, something that simple, I never would have thought of. And for me, I was here at 4 a.m. on our last session day, I believe, as Representative Groder and Lekis were here also. And how it affected the legislature was we were hugely impacted by the COVID response. So I think there's a lot of areas to take in. So I think starting with him, and I can contact him to see when he is available. But I think that will help give us a bird's eye overview of everything, and you can ask him how things are working today too, because it's one subject, but we got to start at the beginning, and then we can go on to another topic. I'm open. Representative Belcher.
Thank you. And it really did just help click for me the chronological side of this, because I think it's going to be incredibly important that as far as any sort of final product and what we're looking at producing here, we're going to have to produce a timeline and what happened when. So I think there's definitely going to have to be a chronological component to this. I also like maybe sometimes breaking things out topically, but I do understand the chronological side.
Representative Lekis.
Yeah, I was thinking that perhaps we could be topical and chronological at the same time, in that as a topic came into important, as a topic cropped up, then we explore that topic, and within that topic, the chronology from the beginning to now. And then the next thing that was taken on by, that showed up, do the same thing. And that gives us a sort of logical procedure, but at the same time, well, it makes it logical in multiple ways, so it makes it easier to organize.
Representative Groda.
So while Representative Lucas was talking, it came to mind that I think starting with him, with Homeland Security, is appropriate, because I do believe that what's going to happen is it wasn't like, boom, everybody, this happened, and everybody did the same thing. I think that there are let's just call it each area of responsibility, regardless of what it is, whether it's DPW, whether it was, Parks and Recreation, they all operated independently, right? They all had their own timelines, because I don't think that it was all, everybody walking linearly down this path, because everybody had different aspects and different things to handle. So that starting with Homeland Security might give us the topics that we need to investigate, because that way, does that make sense?
I agree wholeheartedly with that. What is everyone else's thoughts? So is there any more discussion on how we want to proceed as a committee? Representative Belcher, then Representative Leckis.
Thank you. I was just going to ask, do we have any procedures in place for if we're going to have absences that we have the possibility to substitute anyone or anything like that, just to make sure we have a quorum week to week?
Thank you for that question, but because we are not voting on anything and we are a special committee, we do not need a quorum and there are no substitutes. Representative Leckis?
Oh, I just wondered if we have any plans besides our final report of somehow getting out, even if it's just posting a link to each week's Facebook, you know, not, I didn't mean Facebook, YouTube recordings, right? But so that as we're learning, the public can be learning.
These meetings are being recorded, so they are being live streamed as we're meeting today, and then they'll be archived so anybody can go on and see that. And I do understand what you're talking about. Instead of doing a final report all at the end, I think that we should reserve that as we delve in just a little bit further and see how the committee wants to move forward with reporting. We are missing 4 folks today that I'd really like to have input from
Right.
before we make those final decisions.
Do we want to, I know we had a press release way back about that there's this committee was going to happen. Do we want to put out a press release saying anybody who's interested, these are being recorded?
I can reach out to the speaker's office and see if they'd like to do that.
Okay, thank you.
Representative Polo?
Yeah, just wonder if by the end of this session we can have some draft idea for the topics we want to discuss on Friday 23rd, like what time period and possibly what topics, and if we're inviting anyone from executive branch for that specific date.
So I'm going to reach out to the rest of the committee that's not here to see if they are available Friday morning, the 22nd. And then I'll also reach out to Director Buxton to see if he's available, because I really do believe that he would be essential to the start of this committee. And I want to thank Patricia Tilly for suggesting that. So thank you so much, and bringing his name before us. I think it's going to be extremely helpful. Representative Groda?
I think Friday is the 23rd. Is it not? Is it Friday the 23rd? Do I have the wrong year?
No, I think you're right. I think I'm completely wrong.
I want to make sure.
Right, because the 22nd was the session day.
So it is the 23rd.
It is the 23rd. Yep.
My apologies. The days all seem to run together.
We'll modify the recording.
Representative Leckis?
Shoot, now I forgot what I was going to ask. Let me think a moment and remember it.
Okay. Any other suggestions from the committee on how you think we should be moving up? Representative Leckis, jog your memory.
Well, that was the right question to ask. I was wondering if we were going to have like a committee, maybe a Google Doc or something, that as we hear about, that we could have within the committee that said what what topic or what thing we'd like to have and what people to contact. Somebody may have a topic but not know who to contact, but other people may say, oh, this person, this person, this person. Or what questions we may want, somebody else may say, oh, that's cool, I want to know this or this. And if we all put it together, it might help us organize who we want to invite, what we want to ask, etc. I don't know.
I think I'd be cautious about doing that because these are public hearings. And we have to make sure that we stay in compliance of the 91A. So I think I'd be cautious about moving forward in that.
Okay, thank you.
Representative Belcher.
Thank you. Just a newbie question that came to mind is, as far as establishing a permanent record of the committee, if we receive testimony written, anything, it just comes down, and where does that get stored, and how would the public gain access to it at any point in time?
Go ahead.
I can help. So I know that if you wanted to have any information about a bill, let's say, even if it was not this year, in the past, the clerk's office has all the files that contain information on the bill, including the subcommittee reports and all of the voting and all the testimony that was filed for that bill. I would imagine that the special commissions are under the same ruling. So we could check, but I believe that's how it's done.
Yeah, and I would agree with that because as clerks, and I believe you're a clerk also, that everything does get filed by bill. So, and the public can come in and ask for any of it. Yes, Representative Lekis.
Well, just as a follow-up of that, if our document, our planning, asking questions, whatever, was public as far as reading, but not as far as input, like if we could, does that work or not work?
I believe that's something that I'm not sure. Can you repeat that for our researcher?
Okay, the question was I'm just trying to figure out a way to get input and ideas as much as possible. And so that's why I was looking at the Google Doc. If it was a public document, but not everybody, as far as reading it, but not everybody could input in it, only the committee could, would that then be okay and not be a 91A violation? Because I don't want to, the whole point of this was to get information to the public. So I just want to make sure that happens as much as possible. But I also want us to be able to brainstorm in between each week so we can plan who's coming and what we want to ask them. So I just trying to figure out how to do that right. Thank you.
Go ahead.
Yeah, well,
Representative.
let me just real quick. So we already have access, as you know, like through our legislative email to be able to have a working document, right? So we already have that capability. But then that could violate the 91A piece, right? So that would be an issue. So there is, I don't know if we have that capability. There's a capability where literally a working document can be viewed publicly and you can actually see changes live and nobody has access to going into that. I just don't know if that would be the best way to work on that, because when you're in a draft, you're typing and you know what I'm saying? And then someone grabs that and says, oh my gosh, well, this is what, you know what I'm saying? So that it's hard. During committees, we have work sessions that are public, and then people can all come together. And sometimes that is through piecemeal. I love the idea. I just don't know how we could best do it.
I think because there is no special place that I'm aware of, that it is really not feasible to do that. I think that, go ahead, Representative Grota.
So I think that having chaired commissions and being in your position is very difficult, but I think one of the things that's very important is that when we end this meeting, we understand that the date and the time of the next meeting will be 9 a.m. on February 23rd. So we know we're meeting again at that time. We're going to have invited the Homeland Security's director, Mr. Buxton, to come and speak before us. And then what I would recommend, Madam Chair, is that you have an agenda, right? That we are opening the meeting. If you want to do the pledge, you put that on there, and all that becomes part of the public record. So that this all operates on a public record. And I think that you can speak to the Speaker's office about how they want to do that, because different commissions do it different ways.
And I really appreciate your bringing that up, and I think that's a great idea. So thank you so much. Like I said, this is my first time, and because it's such a broad topic, I just really, and I called it an organizational meeting because I just wanted to discuss how we were going to proceed. So, okay. Anybody else have anything that they think we need to discuss further, or should make?
I'll make a motion to adjourn for today and see everybody on the 23rd.
Okay. That would be fine. Again, February 23rd at 9 a.m. with the hopes of having Director Buxton here. Thank you. I don't know if we have to make a motion to end our meetings. I'm not sure, because we don't do that in regular committees.
Yeah, we don't do any. Exactly.
But that's okay.
That's right.
Okay. Yeah. So
You just gavel it. We got to get you a gavel.
I'm good. But does that sound like a plan for everyone? February 23rd at 9 a.m. Director Buxton. We'll try and get him to be here, and I think he'll have a lot to say and give us a lot to think about, so that we can make informative decisions moving forward on how we want to proceed next. If Representative Blackus.
And in the meantime, we can all be thinking of questions and talking to other people to see if they have questions.
Absolutely, and I would encourage everyone to be talking to the people in their municipalities and their school districts and their citizens. I mean, to see if there's anything pertinent that they'd like to know from the director. So I think that would be important. If everyone is all set, we will end this meeting, and it is 1:58, I believe. We'll adjourn. Okay. Thank you all for coming.